Another reason to think about, how do you know when you're pushing too hard on medicines? Jitteriness, tics, and skin picking. Oh yeah. Now listen, you'd say, well, all you're doing is just listing common side effects of medications. Okay, yeah. But again, the point of this is to help you. Those things, you can see those things. You can see skin picking, you can see jitteriness, you can see tics, you can see these things. But, sometimes they're transient, right? So they're there for a period of time and then they kind of fade with time. Sometimes we do adjunctive therapy to try and minimize the effects of those things. But if you see those things, your child may not be responding well to the current dose or the current medication. How do you know? Well, listen, some kids just idle at 8,000 RPMs. Like they just do. Like they're just like, you know what I mean? They're just, and you're thinking, well, isn't that all ADHD kids? Not really. Not all. But some kids, right, they come in and they're thin. They already don't eat a lot. They already don't sleep a lot. They have maybe some comorbid conditions, right? And they just kind of idle their life at 8,000 RPMs. They're just tense and kind of tight, and they struggle, right? Maybe you should, treat anxiety or do a different thing. But sometimes ADHD is the best strategy to use. And those kids, when they idle at 8,000 RPMs, you can spin them out real fast, right? So you put them on a low dose of a medicine, Ritalin 5, Adderall 5, Focalin 5, just a low dose, short acting medicine. And you can see these kids spin out pretty fast, right? And they get jittery and they get tics right away. Let me see if I can show you. So, imagine it's almost like, how you're drinking coffee and you're thinking it's a good idea. You're just doing coffee. You're doing coffee stuff and you cross that threshold. And now all you're going to get is bad stuff happening to you. You're irritable. You're mad. You made a mistake. You don't feel creative anymore. You just want to die. So sometimes kids, even at an appropriate dosing model, they can feel a little bit like that.